And a major public health issue in Nigeria and globally, with Nigeria ranked as the leading country in Africa for TB cases. Concerns have been raised by health experts and stakeholders about the funding gap following the withdrawal of foreign interventions. These concerns were discussed around the 2025 World TB Day themed Yes, We Can End TB. Commit, Invest, Deliver, during a pre-media conference held in Abuja in anticipation of the event. Elizabeth Kasham has more.
Nigeria is estimated to have 499,000 tuberculosis cases developing every year, making it one of the 30 high-burden countries for the disease. Making significant progress, the federal government reported diagnosing and treating approximately 418,000 TB cases in 2024. Chairman, House Committee on HIV/AIDS, Tuberculosis and Malaria, Mr. Amobi Oga, praised the federal government for injecting 700 billion naira to address key public health issues like TB and pledged that lawmakers would expedite the passage of laws to protect TB patients' rights.
We are also concluding plans to pass a law that will protect persons affected by TB from discrimination and stigmatization. We will also ensure robust oversight of all MDAs and key stakeholders saddled with the responsibility of implementing programs aimed at combating HIV, AIDS, tuberculosis and malaria control in our dear country.
Director, Public Health, Federal Ministry of Health and Social Welfare, Dr. Godwin Intadom, in his address said TB mostly affects people in productive age groups, which is from 25 to 44 years, driving many families into poverty.
Despite our achievement, there is still a significant number of missing TB cases that constitute a reservoir for ongoing transmission of TB in our communities. It will interest you to know that one untreated TB patient is capable of infecting about 15 other persons in a year. A more worrisome trend is the suboptimal enrollment of diagnosed TB patients, that is drug-resistant TB patients, on treatment in the last 5 years.
Other stakeholders in attendance discussed the importance of collaboration and strategies to ensure a Nigeria free from tuberculosis.
Successful awareness creation and advocacy for domestic resource mobilization across various states. For example, in Kebbi State, following an engagement with the First Lady of the state, our advocacy resulted in a 50 million naira allocation for an MDR TB ward and 15 million naira in counterpart funding.
Zero TB disease, zero TB deaths, and no family or affected individual should suffer financial hardship from tuberculosis. So this is just to remind us of the different strategies that we've used in controlling tuberculosis over the years, from the DOT strategy in 1994 down to the End TB strategy, which is really an ambitious one, ensuring that all stakeholders participate in our tuberculosis eradication drive.
The 2025 World TB Day commemoration will feature a series of activities as Stop TB Nigeria partners with National TB Program and other organizations to amplify efforts and accelerate actions against tuberculosis. Elizabeth Kasham, ASO Television News.